This is an assessment of the musculoskeletal and the neurological systems. This is my patient, and I'm going to begin by palpating the radial pulse. This can be found on the inside of the wrist. And his pulse is regular and strong. And then I will assess the brachial pulse, which is kind of in the bend of the arm. And that pulse is also regular and strong. And I will assess the range of motion of his hands. I will have him extend and then flex down, extend and flex. And then I'll have him make a fist, open, fist, open, and then fingers together, fingers apart, together, apart. And I would do this bilaterally too. And then I'm going to assess the range of motion of his arms. I'll have him bend at the elbow, and then I will check the range of motion of his shoulders. I'll have you put your arms out to your side, straight out to your side, and then back down, and then back up, and down, and then behind your back. Okay, good. And then I will assess his lower extremities. I'll assess for symmetry, assessing the skin. It's warm, pink, and dry. His hair is evenly distributed. He doesn't have any varicose veins. And I will palpate the popliteal pulse, which is behind the knee. And it's regular. And the posterior tibial pulse is by the ankle. And the dorsalis pedis pulse is on the top of the foot, and that is regular as well. And now I'm going to assess the range of motion of his hips. So I'll have him lay down, and I'll have him lift one leg, and then the other leg, and then I'll have him bend at the knee, and then you can also have them spread their legs, and you can also have them rotate internally their hips. And then I will do the range of motion on his knees. And to do this, I'll have him sit back up. And you can just have them extend and flex, extend and flex. And then I would do the same for his ankles and his feet. And while I'm doing this, I'm going to be assessing the joints and noting symmetry, and then I'm going to do the Bromberg test, which is a test that checks balance and coordination. So to do this, you have your patient stand, close, or raise up your arms, raise one leg, raise the other leg, and now put it down, and now do this with your eyes closed. And this is just to notice the steadiness. And you can also assess the patient's gait. You'll have them walk 10 or 20 feet and assess their balance, coordination, if they're having any difficulty with their gait. And then I'm going to have the patient sit down. And I'm going to assess the Babinski test, which to do this, it's hard to see on the camera, but you, I need your foot. Can you lay down so I can have it in the camera? And you usually use the hammer that they use for the deep tendon reflexes, and you just stroke it along the outer side of the foot. And a normal Babinski is when all of the toes flex. And then I will have the patient, put your foot down, do rapid alternating movements, and this is to assess coordination. And to do this, you can just have them, it's usually like a rhythm, and you have them hit with their palms down 5 times, and then have them turn their hands over and hit 5 times, and then have them do it all together. And then you can do the finger to nose test, and this is also to test coordination. And you just have the patient put his arms out, and then close your eyes, and now you move your hands to your nose, your fingers to your nose. Okay. And then there is the heel down the shin test, and you have the patient rub his opposite leg with his heel, and this tests coordination. So rub your heel along your opposite leg. Okay. And then I will test for his range of motion of his spine and scoliosis, so I'll have him stand back up. And to test the range of motion, I will have him bend over and touch towards his feet. And everything should be symmetrical, and this is also range of motion. To test for scoliosis, his spine would be in an irregular pattern, but his is straight and aligned. And then you can sit back down. Then I would test the sensations of his face, hands, legs, and feet. And to do this, you usually use like a cotton ball or anything that has a light touch. And you have the patient close their eyes and let you know that when they feel the sensation on their face. Close your eyes.
Okay.
Okay, so he was able to feel that sensation, and I would do it to both sides. And then I would do it to his hands. Close your eyes.
Yeah.
Okay. And I would do the same thing to his legs and feet. Tell me when you feel it.
Okay.
And on your feet.
Okay.
Okay. So his sensation is intact in his face, hands, legs, and feet. And then I would test deep tendon reflexes, and for this you need a deep tendon reflex hammer. But I don't have one, so I will show you the location. First, you would do the brachioradial deep tendon, and you have them have their thumb facing up, and you use the hammer to hit right above the thumb, and they should have their their hand should flex when you tap on it. And also you can do the patellar deep tendon reflex, which is when you hit the tendon in their knee and their leg should extend. And there's also the Achilles test, which I will have the patient lay down again. And you actually usually lay on your stomach. Can you lay on your stomach? Sorry. And for the Achilles test, you would hit right here, and you would have movement. You would have movement in the foot. And that concludes my assessment.